Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2023 fourth quarter, part 13. In this video, we're going to cover two coding clinics, and the first one is short bowel syndrome and intestinal failure, and the second one is age-related osteoporosis with current pathological fracture of pelvis. So let's get started with the first one, short bowel syndrome and intestinal failure. And the update here is subcategory K90.8. Other intestinal malabsorption has been expanded and new codes have been created to identify short bowel syndrome with colon in continuity, without the colon in continuity, and unspecified. This expansion also includes a new code to identify intestinal failure. The new codes are as follows: K90.821 for short bowel syndrome with colon in continuity, K90.822 for short bowel syndrome without colon in continuity, K90.829 for short bowel syndrome unspecified, and K90.83 for intestinal failure. Short bowel syndrome is a medical condition that results in the inadequate absorption of nutrients from food due to lack of small intestine. It is typically caused by the surgical removal of the large portions of the small intestine or the absence or damage of the small intestine at birth. The severity of the condition varies depends on how well the remaining small intestine functions. People with short bowel syndrome have difficulty absorbing essential nutrients such as water, vitamins, minerals, protein, fat, and calories from the food. The symptoms of short bowel syndrome include diarrhea, greasy, foul-smelling stools, fatigue, weight loss, malnutrition, and swelling in the lower extremities. Some individuals with short bowel syndrome may develop intestinal failure, which is the inability of the remaining intestine to absorb enough nutrients and/or fluids to sustain the body's needs. However, not all patients with intestinal failure have short bowel syndrome. Intestinal failure can result from a variety of other conditions such as inflammatory bowel disease, celiac disease, radiation enteritis, and other disorders that affect the absorption of nutrients in the intestine. The treatment of small bowel syndrome and intestinal failure is multifaceted and involves intravenous nutritional support to prevent deficiencies and fluid management to treat dehydration. Additionally, disease complications may affect other organs like the liver, kidney, brain, and bones. In individuals with short bowel syndrome, the colon plays a more significant role in the absorption of fluids and nutrients than in people with an intact digestive tract. People who have had their colon removed have a worse prognosis, respond less favorably to dietary therapy, and are more likely to require long-term or permanent intravenous feeding than those with the colon in continuity. Therefore, codes for short bowel syndrome have been divided into with and without colon in continuity with the residual small bowel. Short bowel syndrome with colon in continuity is when the colon has been anastomosed to residual small bowel. This includes ileocolonic and jejunocolonic anastomosis. Short bowel syndrome with no colon in continuity is when all colon has been resected or otherwise is not in continuity with the residual small bowel. This includes mucus fistula, ileostomy, jejunostomy, duodenostomy, and jejuno-ileorectal anastomosis. Now let's move to the scenario. A patient presents with short bowel syndrome. They are status post right hemicolectomy with ileocolonic anastomosis. What is the correct code assignment for the SBS? And the answer here is we have to assign code K90.821 short bowel syndrome with colon in continuity for the SBS in a patient who has ileocolonic anastomosis. So as you can see in this scenario, the patient underwent hemicolectomy, right hemicolectomy. Only half of the colon is removed and the remaining colon is attached with the ileum, that is ileocolonic anastomosis was performed. So the colon is in continuity. We have to assign code K90.821 short bowel syndrome with colon in continuity for the SBS in a patient who has ileocolonic anastomosis. Now let's move to the next scenario. A patient with an ileostomy due to history of bowel obstructions from adhesive disease is admitted with symptoms related to short bowel syndrome. They are treated with parenteral nutrition and fluids. So what is the correct code assignment for the SBS? So we have to assign code K90.822, that is short bowel syndrome without colon in continuity for the SBS in a patient that has an ileostomy. So here in this scenario, ileostomy was performed and the colon is not in continuity. So we have to assign code short bowel syndrome without colon in continuity. Now let's move to the next coding clinic. Age-related osteoporosis with current pathological fracture of pelvis. Subcategory M80.0 age-related osteoporosis with current pathological fracture has been expanded to identify age-related and other osteoporotic fracture of the pelvis. The new expanded subcategories are as follows. M80.0B1 for age-related osteoporosis with current pathological fracture right pelvis, M80.0B2 for age-related osteoporosis with current pathological fracture left pelvis, and M80.0B9 for age-related osteoporosis with current pathological fracture unspecified pelvis. M80.8B1 for other osteoporosis with current pathological fracture right pelvis, M80.8B2 other osteoporosis with current pathological fracture left pelvis, and M80.8B9 other osteoporosis with current pathological fracture unspecified pelvis. In a variety of orthopedic and maxillofacial procedures, a pelvic autologous bone graft may be utilized. When utilized, the iliac crest of the pelvis is the most common site of autologous bone graft harvesting. Either during or after the bone graft harvesting, a pathological fracture of the iliac crest can occur in patients with osteoporosis. An osteoporotic fracture of the pelvis differs significantly from an osteoporotic fracture of the femur, and the new codes will distinguish osteoporotic fracture of the pelvis from osteoporotic fractures of the femur. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.